Hey everybody, welcome back. And today we are going to cover a lot of information today. We are looking at right at 35 days post-op, 6 weeks. So we had our second post-op appointment. Today was a very important day. And we're not going to have any intro or anything. We're just going to jump straight into it because we've got a buttload of information we're going to cover. 6 weeks is usually the time. The sling is done. We are completely done with the sling. The sling got retired this morning. We wore it into the doctor's office like we had been instructed. After that, I was instructed not to wear it in public, not to wear it at all, not to wear it in bed, nothing. So 6 weeks, usually in the sling, we're done with it. So that's a good thing. Another good thing is the repair. We did a test, and the repair for my shoulder is fully healed. It is not going to rip out. It has not been using it for 6 weeks. So that's more than enough time for that those sutures and those anchors to be fully embedded into the bone, and to make sure that that labrum doesn't come up. That was the only concern. The situation with the AC joint, not really that big of a deal because they just cut bone away and realigned it. So that kind of works itself out within like a couple of weeks. But usually 5 to 6 weeks on a labrum repair, everything is good. So now we get to the hard part, or what most people call the hard part and rough part. Me, I call the fun part. Today we had physical therapy directly afterwards. Today we started doing external rotation, and we started being able to lift the shoulder up like this. We began doing physical exercises with that. I'm not gonna lie to you, they sucked, but it felt good to actually be able to have the opportunity where someone tells me that you can actually push through the pain now. So that is something really good, something that the physical therapist definitely knows a lot about, because I've been going to the same physical therapist for the last over a year now. So they know just how well I can push through pain. So when she let me know that, I knew it was go time. I've been given a weight limit when it comes to going to the gym. I've got the green light to go to the gym. So we're gonna start going to the gym tomorrow, and we'll start putting a little bit of weight on it. They don't want me to lift anything usually over 5 pounds, less than 5 pounds. So that naturally means 5 pounds. They don't want me picking anything up. It's not gonna break anything. It's not gonna, the only big thing is that rotator cuff is very vulnerable. So they don't want me putting a whole bunch of weight on there to stress that rotator cuff to where it tears. So that's why we're stuck at a weight limit. So we'll adhere the weight limit for the next couple of weeks. I do believe the doctor said 2 weeks on 5 pounds, and then let the doctor decide what he wants to do. More than likely it'll be 5 pounds for the next 6 weeks. So we'll go back for our next one at 12 weeks, and then we have one more. So we are halfway done with our appointments, but we've still got a long way to go. We've still got roughly 16-18 weeks total, and we're at 6. So we've got about another 12 weeks to go. We'll have an appointment in another 6 weeks to see how everything's going, progressively to see how all that's coming along. It'll be around that time that we will go ahead and start strengthening everything in the back and the front and stuff like that. But I have already began doing that today. So not that big of a deal. And then about February or March of next year, we'll go back, and then that'll be it. That'll be our last appointment, and that should be return to work. Since being able, they want me to actually use my shoulder to pick things up, to move it, to do this and do that. Whereas now I can physically come out to about right here on it. I can't go any higher, maybe about right there, but there is some mobility here. It's still very stiff and very tight, but we do have some mobility in the shoulder, especially in the forearm when it comes to being able to lift out. I can go all the way back here and not be in any pain externally, but coming back, that biceps tendon is very, very sore. It's still very inflamed, very sore. Most of my pain is when I do external rotation is right here and on that external rotator back here. The exercises they have me doing is kind of strengthening these muscles and getting them firing. Anytime I lift it up high and it goes to about right here, my entire arm starts shaking. That's the muscles firing, but they're atrophied. They're practically unusable for the last 6 weeks. So the fact that we're actually using them now, they're fatiguing out really, really fast. So, and I'm talking about one exercise, first exercise today, and my arm started shaking when I got up to a certain extent. So that's how that's going to work. It sucks. Yes, it sucks. It doesn't feel good, but I would rather be in pain and be making progress than be sitting here in a freaking sling for another 6 weeks not doing anything. So we're going to be spending a lot of time doing cardio. We're going to be spending a lot of time doing low rep, high repetitions with low weight, probably anywhere from 1 pound to 2.5 pounds. We're going to try to stay under the 5-pound weight limit just for now, because I feel like using those lower weight at high repetitions is going to help build and strengthen this stuff. We've also got the doctor's going to give a steroid shot in this area next week to kind of help reduce some of that inflammation around the biceps tendons. So that'll actually help with the mobility, and it'll also help with the strengthening. It's a steroid for inflammation, not an anabolic steroid. You definitely don't want to use anabolic steroids after a procedure like this, because you're just going to mess everything up. So it's just stupid. There's a lot of things that don't make sense. That's one of them. That's pretty much it. For the first time in my surgery, there's light at the end of the tunnel. For the last 6 weeks, it's been like dull, mental. It's been complete madness. Feeling like I'm just going to be stuck in this sling. I'm going to be stuck doing this and not being able to use it, not being able to move it forever and all this and that. But being able to take the sling off and giving the go-ahead to actually be able to use it and move it and stuff like this, it's great, because we'll go through a point to where we are moving slowly at a snail's pace, and then probably within the next few days we'll probably jump up here, and then we'll start going at a snail's pace again, and then probably a couple of months from now we'll make another jump. We'll have more mobility, and it's just a snail's pace, and then every now and then you'll make a big jump here and there. Sometimes I am doing exercises at home too, and next week we're going to show you guys what some of those exercises are looking like. They don't want me filming inside physical therapy because of the other people in there. It's such a big area, and they've got everybody in one area, so it's kind of difficult to be able to record while not getting someone else in the shot to protect their privacy. So it kind of makes sense in a way. I don't really want to record at physical therapy because, one, I don't want to put anybody personally, a lot of people don't want their personal life, out there. So we're going to show you guys the exercise she's having me do. She's having me do quite a bit, because she knows she put on the paper 10 reps once a day. So I'm doing 20 reps twice a day. I'm trying to hurry up and get back to work, and that's what the surgeon is also wanting to do. He's wanting to get this done, get it over with. But after today, after being able to, during the therapy, it sucked. It hurt like hell, but right afterwards, it felt great. Like, didn't have a lot of pain. The pain I was having was just during therapy. So it's a good thing that I saved those pain medicines, because I've still got probably about a good 3/4 of a bottle of pain medicine, and I've been saving that strictly for taking probably about an hour prior to therapy to be able to work through the worst part of the pain. The first couple of weeks of therapy, really not even that bad, to be honest. When you're going from week 3 to week 6, you're going to have therapy. All they're going to do is stretch this. That's it. They're going to stretch it, move it, that's it. You can't lift anything. They're going to have you sit on a table and kind of stretch this muscles here down into your neck, but that's all they can do, because protocol, they can't do anything else. So I really don't think you really need to take pain medicine if you're going to be getting stretched out. It's going to hurt, but it's not going to be on a level that it's going to really cause you a whole lot of pain. I would honestly save that pain medicine for when you start doing the real work, when you start doing the exercises. So definitely, we start 3 times a week, feather therapy 3 times a week. Next week, Monday, Wednesday, Friday, all the way until it's time to go back to work. So that's it, man. I mean, we're doing good. We also got the go-ahead from the surgeon today to take a trip in December. He said that around New Year's Eve, me going and riding roller coasters, he feels like I should be using it pretty well by then. He said I should be right at about 50% strength and 50% mobility. So he said me riding rides is not going to be a problem. He said use your best discretion on what's going to hurt you and what's not going to hurt you. So Wonder Woman is definitely probably out of the picture here, but everything else is kind of good to go. So that's our 6th week, 6 down, 12 more to go. Oh well, at least we're a third of the way done, so can't really complain. Well, all right, man, that's going to do it for us here. Thank you guys so much for watching. If you enjoy the content like this, hit the subscribe button, turn on notifications, and we'll see you guys next week. Peace.